let's move on to the next case. A 52-year-old man who is a known case of type 2 diabetes mellitus on irregular medication presents to the OPD with complaints of tingling, numbness and paresthesias over the lower limb since 9 months. He also gives history of a wound formation over the sole of the right foot 6 months back. On examination, vitals were stable, paresthesia present over soles of bilateral foot. Wound was found which was punched out, painless. X-ray right foot revealed osteomyelitis. His random blood sugar values were 240 mg per deciliter and HbA1c values were 7%. So what is the most likely diagnosis in this case? Well, the case clearly represents a case of uncontrolled diabetes since random blood sugar values were 240 mg per deciliter and he was on irregular medication. So, in uncontrolled diabetes, there appear lot of complications. So, what is this complication in diabetes mellitus? And with this, let us discuss some questions as well, that what are the features of small fiber neuropathy, what is the management of this case, what is metabolic syndrome, and explain in brief about diabetic foot. Well, this is a case of diabetic neuropathy as suggested by various clinical features present of paresthesias, numbness. So let's solve the first question, that is what is small fiber neuropathy. So this is a complication in diabetes where there is neural damage because of uncontrolled diabetes mellitus, and in this the patient gets sensation of tingling, numbness, pins and needle sensation, and it is found that feet is affected more, so is present in our case as well. But it is neural involvement, but power and deep tendon reflexes are intact. So we are getting more of sensory symptoms. Plus, it also causes a decrease in sweating and dry skin because of the involvement of autonomic nerve fibers. Now, what is the management of this case? Well, obviously, first is that diabetes should be controlled. Then it is the use of aldose reductase inhibitors. You see, this small fiber neuropathy happens due to accumulation of the sorbitol in the nerves, and what happens that it cannot cross the cell membrane, rather there is entering of water and damage to the cell membrane. So these aldose reductase inhibitors inhibit the sorbitol pathway and hence they decrease the accumulation of the sorbitol. Then we need to treat the painful symptoms, non-steroidal anti-inflammatory drugs need to be given. Then the patient is advised for foot care and proper footwear. Plus, with the damage happening to the nerve fibers, physical therapy is also advised. Fine. Our next question is that what is metabolic syndrome? Well, metabolic syndrome, also known as syndrome X or Rabin syndrome, is a combination of multiple components. So whenever we use the term syndrome, basically it includes multiple components, and the components of metabolic syndrome are type 2 diabetes mellitus, presence of insulin resistance, low HDL, central obesity, and presence of hypertension. This metabolic syndrome is associated with coronary and cerebral vascular disease, which can increase the morbidity and mortality in patients. So it is very important to know about these components of metabolic syndrome. And finally, let's talk about diabetic foot. The diabetic foot occurs due to a combination of various factors. Well, there is damage to small blood vessels in uncontrolled diabetes, what is known as microangiopathy. Then there is neuropathy, as already discussed. Then these patients are also prone to infection and poor wound healing. So many factors combine together for this diabetic foot. Plus, sensory loss actually leads to formation of penetrating wounds. Then, as already said, that it also leads to damage to autonomic nerve fibers. So it also leads to impaired sweating and cracks, which predispose to secondary infection. So there is a formation of painless ulcers which can get secondarily infected, and this leads to wet gangrene. And the treatment obviously includes the control of diabetes, right? The blood glucose should be brought under normal physiological range. Then proper footwear is advised, care of the foot is advised, antibiotics, and if the gangrene has developed, then surgical amputation is also needed. In nerve muscle physiology, we discussed two important cases, myasthenia gravis and diabetic neuropathy. Thank you.